I am Dr. Ira Byock, one of the physicians practicing here at Dartmouth-Hitchcock Medical Center. I want to spend a few minutes talking about Advance Directives and why we encourage all of our adult patients to have an Advance Directive document on file within their medical records. I want to explain what Advance Directives are and why they are important to you and your family. Along the way, I hope to dispel misconceptions some people have about Advance Directives. Advance Directives concern how people want decisions about their medical treatment to be made if they have a life-threatening condition, who people want to speak for them, and what treatments they would want to have or not have. Sometimes when doctors, nurses, or social workers bring up the subject of Advance Directives, patients or their families become worried that it means that their condition is serious and that we know something they do not. Let me assure you this is not the case. At Dartmouth-Hitchcock Medical Center, we bring up the subject of Advance Directives with all of our adult patients. This is why we have made this video presentation. At Dartmouth-Hitchcock Medical Center, we strive to give the very best care possible. Every day, we save lives of people with serious illness and, whenever possible, restore people to full health and function. But while we strive to save lives and to maximize people's independence and function, we also recognize that every human life eventually comes to a natural end. Therefore, whether or not cure is possible, we strive to ensure that people's comfort is preserved and to improve their quality of life. Whenever someone is seriously ill, people who love and care about that person, their close friends or relatives, are always affected by their condition. They feel the pains of illness, and not only can they help, but often families need to help for their own emotional well-being. Thus, in addition to giving the best care possible to patients, we strive to support families during the course of a patient's serious illness. Advance Directives can help us do so. Advance Directive documents and the information they contain are important because in situations of serious health problems, including life-threatening conditions such as stroke or heart or lung failure, one size does not fit all. Everyone is different. People with different backgrounds, cultures, and religions often have strong values and hold strong beliefs that guide their personal decisions, including decisions about healthcare treatments. The decisions that one person might make might be entirely different from the decisions another person might make in the very same situation. What's right for you might not be right for me or somebody else. At Dartmouth-Hitchcock Medical Center, we strive to practice shared decision-making. This means that doctors and nurses work together with patients and their families in developing decisions and plans for care that meet people's medical needs but are also consistent with a person and family's individual values and their preferences for care. Advance Directives are valuable tools in the process of shared decision-making. Additionally, Advance Directive documents are important because without one, there may be no clear legal authority to speak for you if you become unable to speak for yourself. Advance Directives offer a way to communicate your values and preferences for treatment to your doctors in a future time when you might be seriously ill or injured, as well as a way of easing the burden that family members sometimes feel in making difficult decisions in stressful, critically ill circumstances. Advance Directives are most effective when they are based on conversations within families and among the people immediately affected by a person's illness. Therefore, we encourage people to talk about their Advance Directives and to use the documents and workbooks that both the states of New Hampshire and Vermont provide people to guide conversations around their kitchen tables or their living rooms. It is important that people in families know what one another would want in circumstances of serious illness or injury. It's important to understand what Advance Directives are and also what they are not. An Advance Directive document is a planning and communication tool for guiding people through difficult topics of illness and injury. A tool for helping people to identify their own values and preferences for health treatments in serious and potentially life-limiting conditions. And Advance Directives offer people a way to project their caring for their family into an uncertain future that may be stressful for their family. An advance directive is also a resource for family support during times of critical illness. When critical illness or injury occurs, an advance directive document can be a valuable resource for helping to guide family members in making medical decisions along with a patient's doctor. Advance directives are not a doctor's order to withhold CPR, a so-called DNR order. Nor do advance directives represent a decision to simply allow a person to die. Advance directives definitely do not have anything to do with assisted suicide or euthanasia. Advance directives are also different from a property will. They have nothing to do with a person's possessions, property, or financial affairs. Some people confuse the two documents, but they are completely separate, and one document does not affect the other. By federal law, hospitals and other healthcare institutions are required to ask patients if they have an advance directive document or if they would like assistance in completing one. However, at DHMC, we ask about advance directives and offer people help in completing them because we believe that this is part of giving the best care possible. Like many other physicians and nurses and other clinical and support staff here at Dartmouth-Hitchcock Medical Center, I have an advance directive on file, and so does every other adult in my family. I have an advance directive because I want the very best care for myself. And if I am unable to speak for myself, I want my future doctors to know my values and my general preferences for treatment. But I also have an advance directive for another reason: to take care of my family at a future time if I become victim to a sudden emergency, such as perhaps a sudden stroke or accident that leaves me unconscious and with severe, probably permanent brain damage. I know that in such circumstances my wife and my daughters will be left to wrestle with difficult decisions about my treatments. I cannot stop that from happening. That's simply the way things work. But I can do whatever is possible to lessen the burden that they will feel in these circumstances. I want to achieve at least two things for my family, and advance directives help me to do so. First, I want to give my family clear, unquestionable authority to speak for me and to work with my doctors in making medical decisions. Second, I want them to have a written reminder of my values and general preferences that I have for medical treatments in the hope that they will feel that I am shouldering part of the responsibility as they wrestle with medical treatment decisions on my behalf. In addition to myself, every adult in my family, including my two young adult daughters, has an advance directive. We feel that it is part of good health care planning and a way of supporting one another during hard times of serious injury or illness that, like every other family, we know we may well encounter in the future. Advance directives come in two different forms. The first, called a durable power of attorney for health care, authorizes an individual to speak for you in making medical decisions if, at a future time, you become unable to speak for yourself. The second type of advance directive, often called a living will, enables you to express choices about whether to accept or to avoid specific treatments in circumstances of serious, life-threatening illness or injury. In recent years, these two types of advance directives have become commonly combined within a single document. This is the case in both New Hampshire and Vermont. The durable power of attorney for healthcare names a healthcare agent or authorized medical decision maker, someone to speak for you or on your behalf if a time comes when you're unable to speak for yourself. Most people choose a relative, perhaps one's husband or wife or life partner, or a parent or an adult child, brother or sister. Sometimes people choose a particularly close friend. Whomever you choose to serve as your healthcare agent, it is essential that that person knows you well and is someone whom you trust. An advance directive document does not need to be overly detailed or specific to be useful. The power of attorney for healthcare is based on trust between people who know and care for one another. By expressing a person's basic values and general treatment preferences, the advance directive can serve as a guide to doctors and family members in applying those values and preferences to the specific circumstances of an individual's injury or illness. Some people choose to name a healthcare agent or authorized medical decision maker and leave the remaining portions of their Advance Directive form blank. This is entirely acceptable, and the Advance Directive is still valid as long as the form is properly signed and witnessed. At least as important as choosing someone who can speak for you and writing down that choice in an Advance Directive is talking with the person who you would choose to make those decisions at a future time. It is important that they accept the responsibility of serving as your healthcare agent or authorized medical decision maker. It's important also to express to them what you think you would want them to know in situations in which you were seriously ill or injured and unable to speak for yourself. The living will was the original form of Advance Directive. A person can use a living will document to express his or her choices for medical treatment in situations of a terminal condition in which the person is both unable to speak for himself or herself and is likely not to regain the ability to speak. When a living will is not accompanied by a durable power of attorney for healthcare document, it is often less useful because it is frequently difficult to apply an individual's stated preferences to the particular situations in which there might be uncertainty about whether a treatment being considered could extend life or even change the person's condition from terminal to possibly curable. Most Advance Directive forms in current use, including those in both New Hampshire and Vermont, include a section that replaces the original living will. Within this living will portion of the new Advance Directive, individuals can provide specific choices about whether they would want or not want treatments such as cardiopulmonary resuscitation or CPR, mechanical ventilation, which requires a tube inserted into a person's windpipe and a breathing machine to help them to breathe, kidney dialysis, and medically administered nutrition and hydration. This refers to fluids and nutrients administered through a tube inserted into a person's stomach, or fluids and nutrients given intravenously. Both New Hampshire and Vermont forms now have a statement or clause within the Advance Directive document that asks people whether treatments can be given against their objections at some future time in which they are confused or delirious and are refusing treatments that their healthcare proxy or authorized medical decision maker feels are needed and are in the person's best interests. Most people answer yes in completing this section of the form. Thereby, they affirm their trust in the judgment of the person they have chosen to speak for them. This statement or clause often confuses people. It is intended to apply to people who suffer from serious mental illnesses, such as schizophrenia or manic depression, that cause episodes in which they are unable to think clearly, or people who have progressive dementia and are worried that in the future they might become confused and might refuse treatments that they would actually want to have. A common question people have concerns whether their Advance Directive would be valid in other states. In general, an Advance Directive document that is valid in the state in which a person lives is also considered valid in all other states. To be useful, your Advance Directive document must be available when it is needed. Some people keep the original in their attorney's office or in a safe deposit box. While this may be wise, it also means that the Advance Directive might not be available at night or on weekends or in distant locations. Therefore, it is essential to have an Advance Directive copy immediately available to your doctors and family members in the case of an emergency. At Dartmouth-Hitchcock Medical Center, we can scan your completed Advance Directive into your electronic medical record and keep it on file for you, your family, and your doctors to use in the future, even years in the future, if it ever becomes needed. When changes in a person's personal life occur, it is advisable to review and update the person's Advance Directive. For instance, after someone goes through a divorce, or suffers the death of a husband or wife who had been named as the person's authorized medical decision maker, it is strongly recommended that people update their Advance Directive. It is easy to do so simply by completing a new Advance Directive form. We can provide such a form for you to use and can then scan this new completed Advance Directive document into your medical record, thereby replacing the old one. Similarly, if you wish to revoke your Advance Directive at any time, you can do so simply by creating a new document and having it become part of your medical record. We consider the most current or recent document to be the one that is valid. If you are interested in learning more about Advance Directives or completing one, please let your doctor, your nurse, or social worker know that you would like to do so, or simply stop by the Health Education Center. They can provide appropriate forms and, if needed, a member of the DHMC staff or specially trained volunteers are available to assist you in completing your Advance Directive. Once your Advance Directive is signed and witnessed, we would be happy to scan a copy into your medical record and return the original to you. I hope that this short presentation has been of interest and answered questions that you may have had about Advance Directives. I would welcome any thoughts or suggestions you have for improving this presentation and the process of completing your Advance Directive. You can write me, Dr. Ira Byock, care of Dartmouth-Hitchcock Medical Center, or send an email message to ira.byock@hitchcock.org. On behalf of all of the doctors, nurses, and other clinical and support staff here at Dartmouth-Hitchcock Medical Center, thank you for allowing us to be involved in your care.